Hello and welcome to Local Edition. I'm Leslie Layton. Well, science can manufacture many replacement human parts in the lab, but not blood. That's why a local blood bank is working really hard to get you to donate. And here now to tell you why you might want to consider it is Dr. Rick Axelrod from LifeStream. Thank you very much for being here.
Well, thank you for having me.
Why should someone donate blood?
Well, some people should donate blood because patients need it. I mean, that's really the issue. I mean, our mission is we help save lives by connecting donors and patients through the gift of blood. And blood it can't be manufactured, as you mentioned. There's no replacement for it. Patients go into the hospital, they need blood for any number of reasons, whether they're having surgery, whether they're recovering from cancer, and we have to make sure we have a large enough supply of blood products to meet the needs of the patients, similar to you needing gas in your car to run your car.
Now, our area has some of the lowest donor numbers of anywhere. If someone is listening and they have never donated blood, what would you say to them?
I would say to them, just think about that they're saving a life. That each unit of blood, you can save up to 3 lives. And to really concentrate on that. Some of the people don't come and donate because they're afraid of needles. And it's a really small needle and you just get a one prick and then it's over. Some people are self-defer themselves. They actually don't come in because they think they can't donate because they have some sort of medical condition. So, for example, I have diabetes, so I can't donate blood. That's wrong. If you have controlled diabetes, you can donate blood. I had a history of heart attack, I can't donate blood. That's wrong. As long as you're 6 months and back to full activity, you can donate blood. I had cancer, I can't donate blood. As long as you've been treated with chemotherapy, cured, or surgery, or whatever happened, and you're 1 year past all the treatment, you can donate blood. So there are reasons why people self-defer, and I always try to tell them, concentrate on the fact that you're coming in to save a life, and that should supersede any other thought that you have.
And the blood and its products remain local with LifeStream in Southern California for the most part, so the life you save might even be your own.
Exactly, or somebody that you know. So we serve about 80 hospitals in the Southern California area, and all the blood that we collect stays local. That's what's really important to us, is meeting the needs of the local community.
You know, something I didn't know before today is that there is a shelf life for blood, so the need is constant, especially it's even seasonal.
That's correct. So the lifespan of a unit of blood is 42 days. And so we have to make sure, you know, much in the same way that milk has an expiration or eggs have an expiration, blood has an expiration as well, and you can't use it after that time. In addition, one of the products that we use significantly in the region, platelets, that's to make sure that you can clot and not bleed, and particularly for people, let's say, that have cancer and are treated with chemotherapy. Chemotherapy wipes out the bone marrow so that you can't produce your own platelets, so you've got to get them from other people. That product has a 5-day shelf life, so we've got to get that product on the shelf and used in the hospital as quickly as possible, and because it has a short shelf life, you have to over-collect that product to make sure that you have enough to meet the needs of the community. So in order to meet 100% of the needs of the community, we have to collect about 110 or 120% of the need to make sure that even if the product expires, we have more than enough product to transfuse to the patients.
So if someone's thinking, well, maybe, just maybe this time I'll donate, what would you suggest their next step be?
To call the blood center, or go online. There are many ways to contact us. So 1-800-GIVE-BLOOD, that's the easiest way to remember, and just call. It's toll free, it doesn't cost you anything. Go on to our website, www.lstream.org, and you can go on there and you can register and make an appointment online, and there's a lot of information to tell you, things about donating blood, what to expect, what not to expect, lots of patient stories to show you the local patients that have been helped, so it really tells you what you need to do.
Dr. Rick Axelrod, thank you very much.
Well, thank you
for being here. Thank you for joining us.